All right. Which additional finding is most likely to be present? Elevated gastrin, elevated prolactin, elevated catecholamine, hypercalcemia, or hypocalcemia. So 30-year-old man, he has a family history of thyroid cancer, presents with routine follow-up. He's asymptomatic. Vital signs are within normal limits. On exam, a thyroid nodule is palpated on the left lobe. Laboratory findings reveal an elevated serum calcitonin level. Genetic testing reveals a RET proto-oncogene mutation. Which additional finding is most likely to be found? So he has a RET or MEN2 mutation with the thyroid cancer, medullary carcinoma.
Okay, good.
So that is associated with pheochromocytoma. So catecholamine.
Okay, good. I think you worked through that beautifully, right? You know, being part of ENT, and I know you want to do ENT also, but yeah, perfectly way to work through that. Calcitonin, right? It doesn't really have much physiological function, right? If you know, it doesn't do too much with our calcium, but it's one of the good ways to monitor medullary thyroid carcinoma. And also, good genetic testing can also point to that too. Once you figure out it's medullary, you always got to be thinking about MEN2A or 2B, right? And so, definitely for sure, Theo is going to be super important to rule out before you kind of do a surgery. Why do we have to rule out Theo before we take out this medullary thyroid carcinoma?
Yeah, because you need to give them like a alpha blocker, like bentamine before surgery, or else they can go into like hypertensive crisis.
Exactly,
Uh,
exactly, right? You
but I
don't
think the
want to,
interesting
yeah.
thing,
Say it again.
the interesting thing here is like, well, MEN2A also presents with parathyroids, right? So which can cause hypercalcemia.
Sure, sure, for
But
sure. I think the bet. I think you're correct here, right? Because you can also get, parathyroid hyperplasia or adenoma, right, which can also cause hypercalcemia. So that's a good catch that you caught here. Um, I'm trying to think is I have to remember which one is more likely. But I'll probably have to edit this question because, like you said, right? Parathyroid hyperplasia or adenoma is also with 2A, right? And so D could be a good answer here too. So, but yeah, for
I
sure.
think about 2B, I guess, which is medullary and pheo, but then like mucosal neuromas and like Marfanoid.
Exactly. Exactly. Good.